Tip 2.
Okay, so tip 2. Another comment I get by a lot of teens is bad breath. They're concerned about, any kind of, odor, or, they're self-conscious around their friends if their breath isn't so great. So one thing that, the first thing we would start with is proper brushing and flossing.
Mm-hmm.
Okay, so I've got, my little mouth here and toothbrush. So everybody, most people by now, I know, have got their ginormous, don't use this brush. But, you want to angle your brush towards the gum line so your bristles are going underneath your gum line. But also I want you to notice if you're just brushing and not flossing, you're only getting like 3 out of 5 surfaces of your teeth, right? So you're only getting the biting surface, the outside and the inside. You're still missing in between both sides. So you can have like funk sitting there for quite some time if you're not flossing. So flossing, if you're noticing some bad breath, start with brushing well and flossing, and that can seriously help out as far as that's concerned. But another thing that a lot of people forget is taking care of their tongue.
Yeah.
So your tongue has all these little bumps and ridges. They're called papilla, and the papilla stuff can get like wedged in between. So if you ever notice like a coating on your tongue or something like that, it's time you can just use your toothbrush, but they also make these cool little tongue scrapers.
Okay.
This one's made by Breath RX, and you just hook it like a little U and just scrape your tongue with it.
Okay.
There's like a soft side and a regular side. You can do that like once a week. Every day if you feel like your tongue tends to build up more, but that's another, because you could be brushing and flossing really well, but you got stuff stuck on your tongue.
Right, absolutely.
That isn't coming off, so that's good. And then another thing I love is this mouthwash. So Listerine makes a great mouthwash with fluoride in it.
Okay.
So up until like 15 or 16, your enamel's still kind of absorbing a lot of the stuff around it, and so it's a good time to get fluoride into the mix, because the fluoride incorporates itself. The fluoride ion incorporates itself with the hydroxyapatite, which is the main component of enamel, and it can really strengthen the enamel, especially if you're under 15 or 16. So I like that rinse, and I like one by ACT, a fluoride rinse, and so that helps with the breath, and you're getting your teeth stronger at the same time.
Absolutely, those are awesome.
Yeah.
So also, something that may affect, I'm just throwing in my ped stuff in.
Yes.
Breath is health conditions.
Yes.
I'm thinking of allergies, chronic congestion.
Exactly.
Something you had mentioned to me before. So if you stuffy all the time, itchy, sneezy all the time, and you feel like you have bad breath, your mouth breathing a lot, you can't breathe through your nose, talk to your doctor about treating that, because that mouth breathing dries your mouth, right?
It sure does.
And that makes stinky breath.
It does. It sure does. Also, post-nasal drainage and stuff can give you that. And another medical condition that can cause that is acid reflux. So talk to your pediatrician about acid reflux, because if you've got stuff coming up from your stomach all the time, then that could be another cause. So if you've tried the oral health and you're brushing and you're flossing and you're tongue scraping and doing all that stuff, talk to your pediatrician about underlying health causes that can be.
Can that acid interfere with the enamel in the teeth as well?
Absolutely,
from reflux?
absolutely. So a lot of people that are not eating a lot of sugar, brushing and flossing well, but still getting cavities, we're finding that their reflux is just keeping their mouth in an acidic state, and so that acid is deteriorating the enamel, breaking it down, and their saliva is supposed to function to counterbalance that or neutralize that, but if there's so much acid coming up all the time, it can't buffer it like it should. So that's a really important thing to talk to your doctor about.
And one more is bad habits like smoking.
Oh yeah.
The teeth, the smile.
For sure.
And the breath.
Yeah, the teeth, the smile, the breath, and obviously mouth cancer can be linked to smoking in the long run, lung cancer, all those things. Staining of your teeth, if you're worried about them being white, that's going to just really do it in for staining.
Gum disease.
And not just smoking, vaping, all those other ways, chewing tobacco, all those other ways that all tobacco products, really nothing is safe to use.
And like you said, with the smile, that good oral health, the brushing, the flossing, all of those things are so important for the oral cavity, because if you're talking to someone, you meet someone, the first thing we likely notice is the smile. And when you're talking to someone, sometimes when I see patients or I meet people, I can tell something about their health.
Absolutely.
If their gums are swollen and red, if I see cavities, if those things are obvious. So that can tell about you.
Right.
So you want to live a healthy lifestyle, cut back on the habits, do all these wonderful tips she's already talked about by taking care of your teeth and your oral health.
Absolutely.
So, yeah, that's very good information.